Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Hello and welcome to the ANEW Insight Podcast. I'm Dr. Supatra Tovar, and I am so excited to have neuropsychological expert and president of the Los Angeles County Psychological Association, Dr. Cris Scaglione, with us today. Dr. Cris, welcome.
Thank you. Thank you for having me.
I am very excited to pick her brain about all things neuropsychology and all things LACPA, but I'm going to read a little bit about Dr. Cris first, and then I'll get right into the questions. Dr. Cris Scaglione is a clinical psychologist with a PhD from Fielding Graduate University. With a career spanning since 1985, she has extensive experience in therapy, cognitive rehabilitation, and neuropsychology, assisting clients dealing with trauma, loss, neurodiversity, and chronic illness or injury. Dr. Scaglione adopts a practical and varied approach, integrating biopsychosocial perspectives with depth, humanistic, trauma-informed, and mindfulness methodologies, while emphasizing self-care and focusing on clients' strengths and resources. Her background in anthropology and personal experiences contribute to her sensitivity toward issues of identity and culture. Dr. Scaglione serves as the president of the Los Angeles County Psychological Association, where she is committed to promoting diversity and inclusion within the psychological community. Dr. Cris, welcome.
Thank you.
So, I really want to know about your history. What led you into the field of psychology, and what inspired you to specialize in neuropsychology?
Oh, I actually started out in anthropology, as you mentioned, because I'm just very interested in people. They're fun, they're interesting, they're weird. And I've always been interested in brain evolution, because that's what makes us most different from the other creatures on the planet. And there was, I've had a concussion as a child that wasn't actually a concussion. It turns out to be a moderate brain injury. It still affects me today. Wow. And there's other neurological issues in the family that I knew were pretty profoundly influential on the person and also the family members. I think one of the fun things about going into neuropsych, though, was that I also grew up with family friends that had really pretty severe neurological impairment and should have died really young, but they didn't. They're still alive in their 90s.
Wow.
And they do so, I'm pretty convinced, because they're happy. They seek out joy. And it takes just very little, mind you, but they're fun, happy, lovely people to be around, and they've outlived everybody's expectations for what should have happened to them. So those were all very heartfelt and interesting things to me, and I thought it would be interesting to pursue a career in that field.
I love that. Give us a picture of neuropsychology as a specialty.
Oh, okay.
How is that different from, say, someone who's just, treating depression or something like that? Mm-hmm.
Well, we treat plenty of depression as well, but neuropsych now is a little different than it was when I came up. You could be a regular clinical psychologist and simply say on your work sites, send anybody to me that looks like they have any kind of brain history, concussion, dementia, that sort of thing. And you learned that way. You took specialized courses as well. And you also sought out specialized training, say in assessment, that sort of thing. Now you have to have more specialized training and more specialized supervision. But generally you end up doing essentially clinical psychology with a lot of assessment, and that's where it ends for a lot of people. But a lot of us also really enjoy doing therapy with individuals, families, couples, having them adjust to what has happened to them, or what they were born with and have to deal with that's different than the rest of us have to contend with. And I also like doing cognitive rehab, which is essentially helping people build on the skills that they have in order to keep themselves organized, on point, happy, as functional as possible. So I think a lot of people think that neuropsych is just assessment. It's a great deal more than that. It's the application of that knowledge to help people live a meaningful life. That's how I see it anyway.
I love that. And I think a lot of people don't really fully understand what neuropsych assessment really is. So if you could explain to our audience who may not have any experience at all in assessment, what exactly is it and what do you use it for?
Okay. Excuse me. Sometimes an assessment will be very pointed. Somebody who is interested in whether or not the kid has ADHD. So it's going to be a fairly, it's a smaller, less involved process of assessment, testing, etc. But I'll start with a broader picture. If you have a stroke, for instance, or a brain injury, or you're not sure exactly what's going on after the car accident, we get a history, we get personality testing, and we do then specialized tests of your thinking processes. We try to do a pretty good survey of attention, memory, perceptual skills, motor skills. We do almost like a substitute brain scan in the sense that we do